Hello, my name is Catherine Leblanc and I'm a faculty lecturer at the Ingram School of Nursing of McGill University. In this video, we're going to demonstrate how to withdraw medication from an ampule and to administer it via the intramuscular route. For this technique, we will need the actual medication, a filter needle, a regular intramuscular needle, a syringe, a label, alcohol or chlorhexidine swabs, gauze, a sharps container, as well as hand sanitizer. Before we start our withdrawing of medication, we will perform hand hygiene. The first thing to do when preparing medication is to perform our 10 rights of medication administration. The first right is the right patient. Always looking at our medication administration record, we compare the name on the record on the patient's bracelet that we will do when we get at the patient's bedside. We need two separate identifiers at least, so name of the patient, date of birth, or medication record number. So this is for our right patient. For the right medication, always comparing the MAR with the medication. So in this case, we have Practi-Amp and Practi-Amp on our medication. The third right, the right dose, in this case, again on our MAR, we have 1 milliliter, we have 1 milliliter on our ampule, and when we will withdraw the medication, we will confirm again that we have the proper dose. In terms of right route, we have intramuscular according to the MAR, so this is how we're going to administer it to the patient. The right time, in this case, it states daily, so once a day. We will make sure that the time is the appropriate time for this specific medication. For the remaining 5 rights, we're going to perform them once we're at the patient's bedside. So now we're ready to prepare our medication. We also want to make sure that we check the allergy status of the patient, make sure they're not allergic to the specific medication we are going to give. So, preparing the medication. First of all, for the glass ampule, we have to make sure that there's no medication in the head of the ampule. To remove the medication that would be stuck there, we can either flick it or we can perform circular motion on a flat surface to ensure that there's no liquid left in the head of the ampule. So once this is ready, we're going to disinfect the neck of the ampule with alcohol swab. We're going to rub the neck for at least 15 seconds to ensure there's no microorganism left on the ampule, and we will let it dry completely. The drying part can take up to 15 seconds, even 30 seconds in some cases. So we want to make sure that we let it dry completely. To open the ampule, we can take non-sterile gauze, or it could be sterile gauze. It makes it easier, but it's not always available in all of the settings. So you can grab the ampule with the non-dominant hand. We're going to take the gauze, wrap the head of the ampule, and with a quick motion away from us, so I'm opening it away from me to prevent shards from coming towards me, we're going to click it open, okay? The head of the ampule goes directly into the sharps container. So now our medication is ready to withdraw. We're going to grab onto our syringe, always keeping the tip sterile, and we're going to attach a filter needle. The goal of the filter needle is to collect every small pieces of glass that could be inside of the glass ampule. So the filter needle is going to collect those micro shards of glass and keep it in the filter. When opening the needle, always in front of you in a quick motion to avoid needle stick injuries. Now, to withdraw the medication, we're trying to avoid as much as possible touching the side of the ampule to prevent contamination. So you can insert the ampule, insert the needle, and invert it. The liquid is not going to escape because there's no air in the ampule. We have to make sure also that the tip of the needle is always in the fluid to avoid withdrawing air in the ampule. So we're going to withdraw all of the liquid from the ampule and then discard it in the sharps container. Now, we need to recap our needle without risking needle stick injuries. So with the one-hand scoop method, we're going to grab onto our cap and then click it on the top of it. Now we want to get rid of that big air bubble. So holding it at eye level, we're going to push that air bubble out until we are at the 1 milliliter mark, which is our right dose. Now, if you have small air bubble, you can always flick your needle and push them out of the syringe. Now, we need to change our needle because this needle is not appropriate for an IM injection. So, withdrawing a little bit the plunger to make sure there's no liquid left in the syringe, we're going to remove the filter needle, discard it in the sharps container. So now we're ready to attach the proper needle to our syringe. In this case, the volume that's to be injected is 1 milliliter, so it is okay for us to administer it via the deltoid muscle. So in this case, we're going to take a 22 gauge needle, 1 inch long. So I'm going to connect that new needle to my syringe, and I'm going to push the plunger so that I'm still at my 1 milliliter mark for the correct dose. So now I have my medication ready. The only thing I have left to do is to prepare my label so that I know what's in my syringe. So on my patient label, I'm going to write my patient's name, my patient MRN. I'm going to write the medication, the dose, 1 milliliter, the route. I'm going to write the time. So right now it is 9 o'clock. I'm going to sign my name, the date, and the time I wrote it already. So my label is ready. I'm going to put that on my syringe, making sure not to obstruct the view of my dose of medication. And then I'm ready to go into my patient's room to administer the medication. So now that our medication is ready, we're going to go into the patient's room. Before entering, always make sure to knock on the door and ensure privacy right after. To administer the medication, you will need your actual medication, chlorhexidine or alcohol swabs, dry gauze, your sharps container, non-sterile gloves, and hand sanitizer. Before we start, we will finish with our 10 rights of medication administration. As we stated at the beginning, we need to have the right patient. So you're going to go into the patient's room and ask them for their name and date of birth, and you will confirm it yourself looking at the bracelet to make sure you have the right patient. So now we have the right patient. Now you're going to perform the proper assessment. So according to the medication you're given, you're going to assess the parameters that are needed for that specific medication. The next right is the right education. So you're going to tell your patient about the intended effect of the medication as well as possible side effect. The next right is the right to refuse. So you're going to get the consent from the patient and let them know that they have the right to refuse it if they don't want it. For the remaining 2 rights, we're going to do them once the medication is administered. So we are ready to start giving the medication. You want to make sure that the bed is at a proper height for you. So in this case, I'm going to administer the medication in the deltoid muscle of the patient, so this height is appropriate. So now that the bed is at the appropriate level, I'm going to lower the side rail to have a better access. Once the side rail is down, you want to make sure that you stay close to the patient to avoid fall in your patient. So as we stated earlier, we're going to use the deltoid muscle in this case. To landmark properly, to make sure we're on the proper muscle, in this case, so we're going to use the 5th finger that we're going to put on the patient's acromion process. We're going to lower our hand and then use 3 to 4 fingers according to the patient and draw a triangle using our finger as the base of our triangle. So the middle of that triangle is our site, is our deltoid muscle. So this is where we're going to inject the medication. So now we're ready to disinfect. We're going to grab our alcohol or chlorhexidine swab and disinfect in a back and forth motion, scrubbing the skin for at least 15 seconds. Back and forth motion. Now that it is disinfected, we must wait for at least 30 seconds for the skin to air dry completely. So no blowing, nor no fanning of the skin. Now I'm going to put on clean gloves as my site is drying. So my site is dry. I'm ready to inject the medication. So I have my gauze and I have my sharps container closed. So when opening the needle, again, it has to be in one quick motion. With your dominant hand, you're going to grab the syringe. You're going to stretch the skin on both sides of your muscle. And when you go in, it has to be in one quick motion at 90 degrees. So you're going to warn your patient, so sir, I'm going to go in on 3. So 1, 2, 3, and you go in. Now, you stabilize your needle with your dominant hand, and you're going to press the plunger slowly to inject your medication. When injecting intramuscular medication, the rate should be about 1 milliliter per 10 seconds. So you're going to inject the medication slowly into your patient to prevent discomfort and also to allow the medication to diffuse in the muscle. So once all of the medication has been administered, you must wait for at least 10 seconds, again, to make sure that all of the medication has diffused in the muscle. When you're ready to go, you're going to remove the needle the same angle as you went in, dispose of it in the sharps container, and apply a dry gauze on the site and apply very mild pressure. If there is no bleeding, you don't need to put a tape on it. You can just let it be, okay? So once your injection's been given, you can lower the patient's gown. We're gonna put the side rail back up to prevent, again, patient from falling. And I'm gonna remove my gloves. Now, after the medication's been given, the 2 remaining rites are the right documentation. So once I go back to the nursing station, I'm going to make sure to initialize and sign the medication that I just gave. I'm also going to write, in this case, which site I use. So in this case, the left deltoid muscle. My last rite is the right evaluation. So at the peak of action of the medication, I'm going to go back to my patient and assess for the intended effect of the medication as well as the presence of side effect. Thank you for watching this video.